True or false?
Dr. Ceballos, what is your expert opinion between generic and brand?
Okay, so I was actually working in before and making the medications generic. So it's very important that people understand that generic medications actually is very effective, like a brand. So in order for a medication to be generic, it has to prove this 95 to 97% effective, like the brand. So it's actually in order for the FDA give the license to be generic, so they have to prove this. So the patients has to try the generic, and it's going to be the same effect of the brand. Some patients have difference. It depends, but it's good to take the generic first because it's actually less expensive for the patients.
True. The FDA requires generic drugs to have the same active ingredient, strength, dosage form, and route of administration as the brand name drug. The generic manufacturer must prove its drug is the same or bioequivalent as the brand name drug. All manufacturing, packaging, and testing sites must pass the same quality standards as those of the brand name drug manufacturers.
How do you think that Obamacare has affected your patients? What type of dilemma do they face in order to get their medication?
So these patients are going to Mexico to get the medication, or sometimes they only fill the medication once every 3 months. So it's actually, I don't think it's been affecting my patients to actually be to have a good adherence of the medication, because the Obamacare is very expensive payments every month.
So one question. Your boss, about how many people did he employ?
At the time when we were 3 employees, I thought it would be better for me, better affordable for me to go through Obamacare instead of they paying my insurance. And he told me it would be cheaper for you to go and buy the medication. Your copay will be less than what you're paying now. So, without further information, that's why I started having some kind of problems getting first the premium for me and my son. Being a single mom, I have to provide for him. And first, the premium was really, really high, what they give me. Nothing to like what they said is going to be affordable, it's going to be cheap. It was nothing like that. The first time I have to go and get my medication, I find out that my copay was even higher than what I used to pay before.
Dr. Ceballos, what is your expert opinion on the future of the health industry and medication?
So the government has to change the Obamacare, or they have to have a more easy access to our patients to have their medication.